Since Larry King started his career in the 1950s, he has interviewed over 50,000 noteworthy people. He's asked them to reveal their secrets, many of them secrets of the heart. I'm Dr. Freda Lewis-Hall, Chief Medical Officer of Pfizer, and I'm here today with Larry King to ask him some questions about not-so-romantic affairs of his heart.
Well, I had a heart attack in February of 1987. I smoked since age 17. I don't remember having any chest pains. Sometimes I'd cough a little, but I never had much major discomfort. And then one night I'm doing my CNN show, and at the end of the show, the guest was C. Everett Koop, the Surgeon General of the United States, and he said to me, you don't look good. Are you still smoking? And I said, yes. He says, why are you still smoking? I said, hey, Doc, I'm 53, I smoke. He said, I don't like the way you look. Go see a doctor. So I left that show, and then I went to do my radio show. I finished my radio show, went back home, and about 4 in the morning, I started to get a terrible pain in my right shoulder, and it was really bad. So I called the doctor, woke him up. He said, as soon as it's morning, get over to the emergency room. So I took some pain pills, and I called up my producer, and the producer came over, picked me up in a car, and we drove to George Washington Hospital. I was smoking going into the hospital, by the way. I put the cigarette out. By the way, then you could smoke in the hospitals, tragically enough. Anyway, so now I'm sitting in this cubicle, and the pain's gone away, and this doctor came, and he said, listen, you have a gray pallor. I don't like the way you look. I know the pain's gone away, but I think it's going to come back. I'll sit with you and wait till it comes back, because it's coming back. Then it came back. And when it came back, they took some blood while pain was going on. And then they looked at they went over to the wall and they were looking at the results like x-rays. And suddenly the doctor turned around, a couple of nurses turned around and came running toward me. A blue light went on, and it's circling blue light. And I turned to my producer and I said, I don't think this is a pulled muscle. And the doctor came running up to me and he said, Mr. King, you're having a heart attack. Just like that. And I said, am I going to die? And he said, good question. We don't know. I was a little ashen and stayed in the hospital 5 days. Left 5 days later, drove home, threw the cigarettes into the Potomac, and never smoked again.
Now, was that the first sign of heart trouble that you...
Doctors would tell me you ought to stop smoking. I'd do examinations. I'd take the x-rays, the chest x-rays and the like, and they would say, we think you ought to stop. But no one ever told me, you have heart disease.
But you weren't having any trouble, say, walking a distance, you would get shortness of
Yes,
breath?
I would get shortness of breath.
Okay.
Oh, yeah. But I told myself, hey, I'm over 50, you walk, you get shortness of breath. It would go away as soon as I stopped. I'd walk, get shortness of breath, stop, went away.
And then up a flight of stairs.
Yeah, occasionally up a flight of stairs, but I never thought I had heart disease. Now, I would see all the commercials, stop smoking. I would tell you how stupid I was. You know, they started printing on the packages, may cause cancer, may cause. Some packages said, may affect pregnancy. I would buy those packages.
So you didn't have to take a
Didn't
look
affect
at them.
me, yeah. So yeah, I shouldn't have been shocked that I had a heart attack. I should not have been shocked, except it wasn't chest pain.
In terms of your risk factors, you talked about smoking. What about your diet, your exercise?
Well, all of that. I ate the wrong food. I smoked. I ate buttery stuff, the French toast, the wrong things, the apple pies, everything. I ate everything wrong. I didn't exercise. I was 30 pounds overweight. I weighed 190. I weigh 160 now. I did everything wrong, and I had the gene. My father died of a sudden heart attack in 1943, and he was 46. My brother, who never smoked, had heart surgery 6 months after I did. He didn't have a heart attack, but he had heart surgery. So it runs in the family. I have 2 boys, and they're both tested for cholesterol and the like.
Many people, as they come up on the anniversary, kind of the age that their parent died or a
I
significant
always
health
thought I
problem.
died at 46.
Did you think?
Yep.
A lot of people suffer from depression after they've had a cardiac event. Did you suffer from depression, and could you tell us a little bit about your experience?
I didn't know what it was. I would cry, and I didn't know why I was crying. So I couldn't call it depression. I wasn't feeling terrible. I would cry. My doctor said that that's very common because the heart is a romantic thing. It's there's so many songs about the heart, and a stranger touched your heart. I mean, my heart was moved. My doctor moved it aside and put on the heart-lung machine. So he told me it's very common among his patients to know that someone touched my heart. And Alexander Haig, who had the heart surgery, late Alexander Haig had the heart surgery. And we were in first class flying down to Miami once, and both of us were weeping. And the stewardess came over and said, "Are you all right?" And he said, "That's all right. We're both heart patients." But that went away, and then I never had it after that. But I didn't think suicide. I didn't know why I was weepy, but I was weepy.
And I understand that you've done a lot of advocacy to help other people.
I do. I started a foundation. I talk to groups. Sometimes if I'm in a hospital, they'll tell me there's a heart patient and I go over and talk to them. I'm very heart aware and I'm very pain aware. And I just celebrated my 80th birthday. Now, I never thought I'd be 80. My father died at 46, as I said, so I never thought I'd be 80 years old. So I started to help people, and we formed the Larry King Cardiac Foundation. And what we would do, we do galas every year. We do one in Washington, one in Los Angeles. A lot of major entertainers come. We have a panel of doctors, and we find people. And we think over the past 25 years, 26 years, we've averaged maybe helped a heart a day.
And you've then met hundreds, if not thousands, of people who have cardiac problems. You, the poster boy, I mean, the discipline that you know, engaged in, the exercise, changing your diet, stopping smoking, is that what you see in most of the people that you engage? And if not, what do you say to them?
I became poster boy for heart disease. Look, first thing I say is, if it's a smoker, you can stop. Because I used to say, I'll never stop. You can stop. You can stop smoking. That's baloney. It's a habit and an addiction. I said the other day, do you know an adult who would start smoking? Do you know any adult who would say, I'm 29 years old, I think I'm going to smoke? No, there ain't no. So don't smoke.
So tell me, what do you think is the best part of getting old?
Best part about getting old is it's better than the alternative. When I was a kid, I never knew anyone 80. No one was 80. People were dead. No one was 80. 60. We saw a 60-year-old man when we were kids. He was old. I remember whispering to my brother once about my uncle. You think he has sex? He's 60 years old. Nah, he's crazy. He's old. Now, I'm 80. I'm seen every day. Look at the things I'm still doing. I do a show every day on Aura TV, interview people. It's on the internet. It's distributed by Hulu. I do a daily radio show called Dropping In with Larry King. It's on Cumulus Radio, and it's on the front page of AARP. I do speaking engagements all over the world. I keep active. I stay in the hunt. I stay in the hunt. As someone said to me, you're past the age of retirement.
And you're saying, I'm just getting started.
What am I going to do when I grow up?